emotional aspect is so important. Sometimes we're just not aware that we are carrying so much until pop, you got this condition. You have got this condition, this disease, this medical, whatever the issue is. And then we have to pause and, okay, where do I start now? What is it that I'm carrying? And this always boils down to the emotion.
I see a lot of autoimmune these days. Do you think that is also why there's a rise of autoimmune? No one's dealing with, there's all these suppressed emotions inside.
Yes, and that's true. Anything that is literally suppressed, it's not healed, it will manifest. So if you look at it, right, if we talk about the future medicine, it's going to be energy medicine, right? Because we are energy beings. So, and I think what I was so drawn to pranic healing. Can I just explain a little
Yeah,
bit about
yeah,
pranic
talk
healing?
about it.
Because pranic healing is based on principle. Now, pranic healing is also scientific evidence because when you look at the pranic healing books that, so I've currently done my level 4. Level 1, 2, 3, 4, you can see the books is all this. It has got references and it's just like opening a medical book. The only thing is the anatomy, everything is there. The only thing is we are dealing on the energy aspect. So the principle of pranic healing is basically what we are dealing with is our bodies, we have chakras, right? So chakras are like the meridians, in Chinese, they call it the chi, right? So with the chakras, what we are doing is we are cleansing and we are energizing, we are balancing our chakras, we are balancing the energetic part of it. Because all disease, once it manifests physically, you see, on the medical school, we are taught to deal with the physical aspect in pranic healing or Reiki, because I don't know much about Reiki, but I know it's also like an energy thing. But pranic healing, it's basically you are trying to prevent or heal the energetic part before it manifests in the physical aspect. And it really works. I mean, from what I've been learning, and of course, as pranic healers, we practice on one another. And I volunteer at the healing camp, and the feedbacks that you get and all that is just really, really interesting.
Can you share a bit more, like how do you use it in, like, say, your daily practice with patients?
Use pranic healing on them yet because it's something that, of course, when you want to heal someone, you have to get their permission. You cannot just be a savior and try to heal and to see whether they're open to it because not many people are aware of all this Reiki and pranic healing. For them, it's also like a woo. But where we derive the energy, the prana is energy. We're getting it from our environment, and a lot of it is from the sun, from the environment. So when we are drawing the energy from them, but we also use a lot of color pranas, color energies, and we just channel to the chakras, whichever area that needs healing.
As I'm talking to you, I realized that actually, treating people, patient, like holistically it's so underrated. As in, we talk about it, but we don't really practice it. So, like all this prana healing, and I'm sure it's not new. It's probably that, like ancient times, it was there, and then suddenly came modern medicine where we have drugs and pills and surgery and all of that, and we've forgotten the, like, what was there before that. And now we're trying to go back to that, like the tradition. I won't say traditional, but ancient knowledge of healing. So I think the key here, from what I'm understanding, is that this is how we deal with it, right? Western medicine definitely has its place. It can fix the current ongoing issue like quickly, like just get the body stable. And then after that, what is the other holistic ways you can go to the root cause? Because once someone, I mean, if I'm gasping for air, you can't do your pranic healing on me, right? You have to deal with that pressing issue. But after that, you can actually take your time to really go down to the root cause to figure out what's really going on. So there's no this versus that, but like how does it all come together?
And Selena, that is going back to the basics, right? So I've got nothing against allopathic, yes, because we need a certain drugs at certain times. So use it when it is needed, right? But a lot of it depends. To me, it's if you're going to use it to basically address your clinical symptoms, then you are missing the root cause, right? So to me, this is going back to the basics. And that's what I like about integrative because, we are going back to our biochemistry during our medical school. And the funny thing is when we have become a doctor, we are just taught to prescribe drugs. And, one of the things, let me show you. Have you seen this chart? This is the methylation cycle by Amy Esco. So I use this to explain to all my patients when they come as to why it's important to address all at the cellular level.
The last time I saw that was a medical student. I probably don't, don't remember it so much now.
Yeah, it's going back to the basic. So and when you show them, you explain to them, and for some of them they'll start taking notes. And I think those are the people where they understand better, and we are helping them to make a conscious decision for themselves. It's up to them. You want this, you can take this. You want to address the root cause, we have this. And how about we integrate? How about we come up with a particular goal plan? And we address this first, then we look into this, because of course you want to look into when you talk about the expenses, the finances and stuff like that, let's address what's important, the root cause. And then slowly what? So I will always tell them, okay, I can help you here. This is your responsibility. Trying to get adequate sleep is your responsibility. Trying to minimize the blue light is your responsibility. What you put in your mouth is your responsibility. How many times you exercise, it's your responsibility. So they are also given homework, right? Because we are just there to guide them and to help them put everything in place.
That's so important because as doctors, we think that we are responsible for a patient's health, but then you're disempowering the patients because they are the one that's supposed to be responsible for their health. So what I can see is conventional medicine, we deal with the only phase one, but then there's phase two, phase three, and so forth to get someone to the optimum level, and we just stop there at phase one.
So I guess you know what? It takes a lot of patience. It takes time, and whether do we have that time for our patients?
Mark your calendar for Disruptive Doctors annual conference and exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025.
Join Disruptive Doctors. Oh, Disruptive Doctors. Impact.